The nation added more than 232,000 new infections to its caseload just today. Now, so far, more than 1.7 million people in the country are reported to have fevers. More than 62 people have died since the outbreak started, and that was in April. Now, although the nation is reporting more than 1 million people have recovered at this point, global health experts are concerned about how North Korea is handling the pandemic.
So here to talk more about this is Wilson Center Asia Program Director Sue Mi Terry. Sue, welcome. Really great to have you with us. So North Korea is not reporting the number of confirmed coronavirus cases, only the number of people reporting fevers. Why is that, and how does this present a larger problem in this outbreak?
Well, so first, it's hard to know what the real number of anything is in North Korea because it's the most closed, isolated society in the world. They're not doing any COVID testing. So whatever the number that they are saying, this means a lot more of people are probably affected or have COVID cases because they're not including all the real cases. They're only saying people with fever. So what about all the asymptomatic people? What about all these other people? So it's not a real case. So it's going to be it's just a lot larger number in terms of people who are affected. And obviously, this is a serious problem because North Korea is only one of the 2 countries in the world that has not vaccinated its people. The other country is Eritrea. They have put in all their, all their effort was in the prevention basket, right? All their eggs in that basket. No vaccination. Its health system is ranked like 193 out of 195 countries. This is according to one survey, Johns Hopkins University. North Korea is just uniquely unprepared for a pandemic outbreak like this.
And Sue, on that note, North Korea does claim that more than 1 million people have now recovered. But the nation, of course, has limited medicine. It has limited medical equipment and health facilities. It's also reporting a significantly lower death toll than other countries that have seen outbreaks of similar size. So what do you think is really happening here, and what's behind this?
And so again, you cannot rely on what the North Koreans are telling us, right? So the situation is just going to be a lot worse. I'm sure it is a lot worse than what they're saying. And we have some 43% of the population already malnourished. That's about 11 million people that are malnourished, making them very vulnerable to infectious diseases like this. Their healthcare system is, as I mentioned, underdeveloped, dilapidated, the barely functional hospitals. The hospital is going to be overrun. They have lack of medicine. North Korea spends less money than anybody, any country in the world. They spend about under $1 per person per year. On top of all of this, now they are dealing with a severe drought that's been going on for some 60 days, and that drought is expected to continue. So we have food shortages. We have COVID cases. I think this is going to be a big humanitarian disaster.
It is something we will continue to stay on top of. Sue Mi Terry, thank you very much for joining us.
Thanks for having me.